Good evening, friends. Hope you are doing good. Today we are going to discuss about another triangle called as digastric triangle. After so many days, again I have come to your presence. So with a new topic, let us see about it. So before going to explain or before going to explore about this digastric triangle, please subscribe to my channel. Let us discuss about the boundaries of the digastric triangle. So here in the picture we can see that it is extended neck. In the extended neck we can clearly identify the digastric triangle after removal of the skin, then the subcutaneous muscle platysma, then the investing layer of deep cervical fascia. After removing of the three layers, we can identify the digastric triangle very clearly. It is a part of anterior triangle. Let us discuss about the boundaries of it. Anteriorly, or we can call it as below and in front, we can identify anterior belly of digastric. Below and behind, we can identify the posterior belly of digastric, and also we can identify the stylohyoid muscle fibers. And above it is formed by the lower border of the body of mandible, and line extending from the angle of mandible to the mastoid process. So between these three boundaries, you can identify this digastric triangle. Now, what are the contents of that? Before going to see that, what are the structures which are forming the floor of the digastric triangle? So the floor is formed by, first one is mylohyoid muscle, and deep to the mylohyoid muscle you can identify the hyoglossus muscle, and also inside to the hyoglossus you can identify middle pharyngeal constrictor muscle. Okay, three muscles which are forming the floor. In the picture we can identify this muscle fibers which we can identify here. They are nothing but the mylohyoid muscle fibers. Inside that we can identify the hyoglossus. After that we can see the middle pharyngeal constrictor muscle. So in the next upcoming pictures I am going to show that floor contents. Then we can, what are the main contents of that triangle? So first we have seen the three boundaries and we have seen the floor, and then what are the main contents which are present in it? Some structures which are present superficial to the mylohyoid, and some other structures which are present deep to the mylohyoid, and then other structures are superficial to the hyoglossus muscle. Okay, so the anterior part and posterior part. If we just divide the contents into two parts, some structures present anterior and some structures present posterior. So the anterior part which are present superficial to the mylohyoid, superficial to the hyoglossus. Then posterior part, they are present behind the mylohyoid and behind the hyoglossus. Now coming to this posterior part of the digastric triangle. What are the posterior part of the digastric triangle contents? Where I told you about that there is a small line. If you just draw an imaginary line at the level of the gonion, it is also called as angle of mandible to the mastoid process. So what are the main structures present in this particular area? Are lower part of the parotid gland, strictly speaking anteromedial surface of the parotid gland, which is present at this area, and external carotid artery. Then we can see behind and medially we can identify internal carotid artery. Then after that we can identify the internal jugular vein and also the vagus nerve. These are the structures which are present posterior part of the digastric triangle contents. Then, as I told you earlier, some contents are present superficial to the mylohyoid and superficial to the hyoglossus. Then posterior part which are present behind the mylohyoid, behind the hyoglossus. Let us see the structures present superficial to the mylohyoid. So superficial to the mylohyoid, we can identify superficial part of submandibular salivary gland. We can also find the facial artery and the facial vein. That I am going to show you in the next picture. Then submental artery, which is the branch of the facial artery before it enters into the face. Then mylohyoid nerve and the mylohyoid vessels. Now in the picture we can identify the facial artery, facial nerve, and the superficial part of submandibular salivary gland. And in this picture we can identify nerve to the mylohyoid. This is the nerve to the mylohyoid. In this picture we can identify superficial part of submandibular salivary gland. And here you can identify the vessels of mylohyoid vessels which are present running superficial to the mylohyoid. Then deep, what are the structures present posterior to the mylohyoid and posterior to the hyoglossus? So coming to the structures which are present posterior to the mylohyoid, they are deep part of submandibular salivary gland. Here in the picture we can see that this red color irregular structure which I am going to show the deep part of submandibular salivary gland, and the duct, this blue color line which is showing the duct of submandibular salivary gland called as Wayton's duct. And here above this deep part of submandibular salivary gland, we can identify a small ganglion called as submandibular ganglion. Then after that we can identify the lingual nerve, and then below that one is hypoglossal nerve. There is a 12th cranial nerve. So the nerve which is present below the deep part of submandibular salivary gland and over the hyoglossus, that particular nerve is called as hypoglossal nerve. Above the deep part of submandibular salivary gland, we can identify the nerve called as lingual nerve. So this lingual nerve is connected to the submandibular salivary gland with the two roots that we are going to discuss in another class. Okay, so these are the structures which we can identify posterior to the mylohyoid muscles, and also other structures which are present in this particular posterior part are stylohyoid ligament, which is extending from the styloid process to the hyoid bone, then the glossopharyngeal nerve, and the lingual artery. Glossopharyngeal nerve and the lingual artery. Let us see the structures once again in the next picture. So till now we have seen the structures which are present anterior to the mylohyoid and posterior to the mylohyoid, or we can also call it superficial to the mylohyoid and behind the mylohyoid. Now we are going to see what are the structures present superficial to the hyoglossus and deep to the hyoglossus. Superficial to the hyoglossus, as I told you earlier, deep part of submandibular salivary gland is present. Below the deep part of submandibular salivary gland, you can identify the hypoglossal nerve. Above the deep part of submandibular salivary gland, we can identify the submandibular ganglion, this red color one, and above it we can identify the lingual nerve. Then above these structures, we can identify the styloglossus muscle, which is extending from the styloid process to the tongue. So these are the structures which are present superficial to the hyoglossus. Yes, you can identify all the structures over here. So this is the submandibular ganglion. Above it is the lingual nerve. Below that one is the hypoglossal nerve. Is coming to the deep to the hyoglossus muscle. What are the structures present? So deep to the hyoglossus muscle, which we can identify is the middle pharyngeal constrictor muscles. Which are present deep to the hyoglossus muscle. Okay, so those are the structures which are present deep to the hyoglossus. So we have seen the digastric triangle boundaries and the contents. So the floor contents we have seen, and also we have seen the main contents of the digastric triangle: anterior to the mylohyoid, posterior to the mylohyoid, or we can also call it as superficial to the mylohyoid, deep to the mylohyoid, superficial to the hyoglossus, deep to the hyoglossus. It is very easy to remember, my dear friends. So in the next class we are going to discuss about a little complicated triangle, but if you just use your senses and also if you just be attentive in the class, it is very easy to understand and we can easily represent in the examination. Thank you, my dear friends. Thank you so much. See you soon with a new class. Till then, see you. Bye.